Thank you for coming to hang with us.
Hey, hey. Hey.
Wow, geez, we're supposed to save that for after, but okay. Thank you. Go ahead, Missy.
Awesome. Good afternoon, everyone. My name is Betsy Kraft. Thank you for joining us today for Advancing the Peer Support Workforce in the Overdose Crisis, a panel discussion with some of Colorado's most influential changemakers representing the peer support workforce from various sectors, including homelessness services, the criminal legal system, healthcare, behavioral healthcare, as well as public health and harm reduction and research and policy. And as we navigate the complexities of the overdose epidemic here in Colorado, it is evident that collaboration and innovation are vital to saving lives and fostering community resilience. Like we've heard this morning, we must also elevate the voices of those leading with living and lived experience, including peer support professionals, as prominent leaders whose insights and subject matter expertise are critical in ending the overdose crisis. On behalf of the panelists, I would like to take a moment to express our gratitude to Attorney General Phil Weisner, Jamie Feld, the Colorado Opioid Abatement Council, as well as the overdose response team for giving us this platform to share our experiences and contribute to this important conversation. So our panelists today will share, we will all share about our diverse work, highlight challenges and champions, as well as action steps our audience can take to become strong allies to this peer support workforce, and our vision for advancing peer-led initiatives over the next 5 years to create sustainable change in the overdose crisis. And we value and look forward to your questions, and we've set aside 10 minutes at the end for questions from our audience. So without further ado, I am honored to introduce our panelists as well as my co-moderator. So I'll start. My name is Betsy Kraft. I use she, her pronouns, and I'm the founder and chief strategist of the Underdog Alliance. And I'm also representing today as my new role as the community engagement specialist with Arapahoe County Public Health. I'm trained and certified in peer support. I have 4 years direct service experience, 2 of which are working in the Denver jails. And I also have 4 years experience working in community engaged research and frameworks and policy advocacy. And so next, I am honored to introduce my co-moderator, Ms. Rika Rodriguez, who is the executive director with Promotores de Esperanza. And Rika has 6 years experience in peer-delivered overdose education and naloxone distribution, as well as over 13 years experience in harm reduction, community organizing, just all around badass, with a primary focus, yes, thank you, with a primary focus in Spanish-speaking Black, Indigenous, and HIV communities of color. And next up, I would like to introduce Brian Godinez, I'm so sorry. Brian Godinez, peer support specialist with Promotores de Esperanza, also representing on behalf of the Denver County Court System. Yes, thank you. Brian has over 3 years experience as a bilingual peer support professional and Promotores, and his experience extends to gang prevention and intervention, peer recovery support services, and the first peer team to work inside the Denver County Court System. Yes, give it up for Brian. Thank you. And then next up, I'd also like to introduce Bruce Ratliff, peer support specialist with the University of Colorado program Wellness Opportunity Resiliency Through Health, also known as the WORTH program. And Bruce has over 10 years of peer leadership experience and played a pivotal role in the development of the Colorado Coalition for the Homeless peer program while serving Denver's unhoused population. And for the past 2 years, serving individuals transitioning from jail to community via the WORTH program. And lastly, Ms. Ashley Jones, Colorado Parent Family Specialist Training Director and Family Services Coordinator with the Yarrow Collective. Ashley comes to us today with over 5 years of experience working in peer support, 2 years experience as a master trainer in intentional peer support, and one of the first to spearhead peer support services and training inside the Larimer County Jail. Thank you, Ashley. Awesome. All right, well, let's get started. Our first question here is really, we have a diverse panel up here, and so we all represent different sectors. And so I'd love for our panelists to share more about your roles as peer support professionals and how you and your teams are advancing peer support services as an evidence-based model specifically to combat the overdose crisis.
And I think I'm on.
Yes.
So I have to look up to see you all and down to see my screen, so don't mind me. So at Promotores de Esperanza, our mission is to promote racial and ethnic health equity through the provision of culturally and linguistically competent services designed to minimize barriers within our most marginalized and underserved Spanish-speaking communities. Thank you to my tia for that beautiful, beautiful mission, because she is my trailblazing mentor and helped me to put all of that together. Thank you, Stephanie. So we've been providing HIV and STI prevention and peer supportive services, as well as linkage to care for over 15 years. I would like to point out that Promotores de Esperanza has only been operating since 2018, but I myself have been living with HIV since 1989. And I've utilized my own lived and living experiences along with several positions in HIV case management field to be able to provide all of those services that I mentioned. It's a real near and dear subject to my heart, and we currently provide support groups for HIV positive women and men who have sex with men. We have been providing AccuDetox services to complement peer supportive services and other avenues of treatment since 2021. It feels like a lot longer than that just because it's been my life's mission. But we've been distributing Narcan and fentanyl testing strips for the past 4 years under funding through DDPHE. I'm going to do that because I can't say that whole thing. And my peeps are right over here, so thank you. We appreciate you. But those supplies are specific to Denver County, so they have to stay in Denver County, which we're thankful that we're also the recipients of the bulk fund through CDPHE, which is a little bit tricky because we don't get paid to do the work. But our CDPHE, they're generously sending us mass doses so that we can connect with marginalized populations and rural communities in Colorado. We've been able to train other organizations of how to identify an overdose, how to administer Narcan, and how to provide aftercare for both parties and individuals involved. And then we're able to send them mass doses every month to be able to, in turn, give to their participants and so that they can train their participants. And we found, sorry, I gotta change my page here. We have found that one very effective delivery method is implementing display cases over the last 3 years of Narcan. They're really discreet, small little display cases that we've inserted into non-traditional locations such as liquor stores and dispensaries and small business owners, nightclubs, Spanish-speaking nightclubs. We have these cases to date in Pueblo, Larimer, Denver, Adams, Jefferson County, and Fort Morgan counties. What is Pueblo County? Sorry, I said that. We've targeted these underserved and indigenous Spanish-speaking communities because we know from data that these are the neighborhoods that are left behind. There are layers of data that show this, and we know that when people are overdosing, there are often multiple substances that are on board. Alcohol is one of those. Sometimes THC is one of those. So we figure if we're putting those Narcan display cases in targeted areas where people can see that they can access it for free, they're more likely to save a life. Another population that we've been honored to work with is the youth. Betsy and I recently provided an amazing first annual workshop for the 5280 Youth and Wellness Conference about harm reduction, safety first, drug education, and compassionate overdose care, as well as the history of liberatory harm reduction movement. So that was a beautiful thing to be able to teach school officials and parents. Can you hear me? Okay. Am I going blind or deaf? I'm honored to announce that Promotores de Esperanza will also be hosting our first time providing a workshop at Servicios de la Raza's second annual. Well, I don't know. I think they've had it more than that. But anyways, October 8th, it's the Youth Leadership Conference for Servicios de la Raza's youth. Who's next?
Oh, okay. Go ahead.
Good morning. So I'm Bruce, and as a peer specialist with the CU Worth program, what we do there is we provide transitional support to folks that are incarcerated in jails, and our primary focus is on connecting folks to healthcare. So folks that have like health-related needs that are not being met in jail because it's pretty challenging to meet those needs in the jail. And a lot of the times those folks tend to fall off with following through with whatever health needs that they have. So as peers, we get to go into the jails, either in person or via video visit, connect with these individuals and support their transition. We also, have, so as a member of the Worth team, we have a health navigator, and we're hiring a second health navigator. Our team is fairly new. This program is fairly new. We have about 3 years direct service, and so our numbers are looking pretty good. They're going in the right direction. Like, we're helping more and more people, and so that's what we look to do. We're collecting the data, we're doing the work, and at least last year we had at least 30% of the folks that have been engaged connect. We hope to double to healthcare, and we hope to double that number. Yeah, and so it's not a large number. So there's a lot of work that needs to be done, and so we want to highlight. I was going to come up here and talk about a lot of statistics and everything like that, but I'm not going to do that. There's a big need for what we do, and as a part of what the team does is, like, we will meet the participant wherever they're at, and whatever their point of need is, and we will identify their goals, and we will work with them simultaneously while connecting them to primary care, specialists, providers, and whatever health related needs that they have there, but also we'll focus on some of the other social determinants of health and some of the core factors that created the health issues to begin with, and barriers to that health. And so let me see, I did have some other things written down here, but my screen went dark. And so I'm not going to go through all the statistics. We're limited for time, but I wanted to focus on we're currently in Adams County, Jefferson County, and Arapahoe County via video visit. And so we're struggling to get into Adams County. It's a back and forth thing. And so, like, when we're able to get in person, our outcomes are better, and our data shows that. And so we're working with the jails and the jail medical staff to try to improve those, that in-reach that we're doing, that in-reach work that we're doing there. And so we need all of you guys' support in doing that. We're also, let me see, here. So one of my colleagues, I want to highlight him because he's not here. His name is Jesse Henderson. He's been working really closely with Jefferson County, and we were able to work with the jail medical staff there to get in-person visits and free phone calls, so the participants and residents in there could reach us. And those folks are much higher likely to engage us once they're out and have their needs met. We have great stories of success. that I don't have enough time to share with you here today. But yeah, we just hope to continue to like innovate and work with the jails and work with all our partners and collaborate with all of you to continue to do that work. So that's all I got. Thanks.
Thank you so much. All of your work is really amazing and inspiring, and I feel like really blessed to be at this table with all of you. My name is Ashley. I use she, her pronouns. You might have seen me at the bigger, more nervous one. This feels a little bit better. So I work for Yarrow Collective. I am training director and family support advocate. We have an incredible harm reduction team. Lucrecia Mendrano is our harm reduction team director. And we also do a lot of work in the Larimer County Jail, offering one-on-one peer support groups, and recently some intentional peer support trainings, which is really incredible. We also offer quite a few groups just as an organization. We have one group, one of our longest running groups, called Alternatives to Suicide. And I know sometimes we think about harm reduction in substances and opioid use, but also I do want to mention that like there is harm reduction to be done around suicidality and self-harm. So all of the spaces really that we have, I consider harm reduction spaces. So just broadening that view of things. So we do a lot of groups and the trainings, and I think like I mentioned this in the other place, but sometimes I think it's just planting that mustard seed of somebody cares just that little much that I can care about myself. And I think that that's really important. I think one-on-one peer support is just such a beautiful honor for me to be able to walk alongside folks in their journey for however long they'll have me. And we do have a training called Liberatory Harm Reduction that we're able to offer. It's a 4-hour training, which is a really amazing training that our group has come up with and or kind of like orchestrated. I don't know what I'm trying to say with that, but it's a great training. And we were able to crosswalk that, and it's recognized by COPA. So for anybody who's working on their peer certifications, that training has been recognized by COPA, so it can go toward your hours. I think one of the coolest things about the peer training that we did in the jail is it's a 40-hour training, which is also recognized by COPA. So all of the folks that took that training can further their education and be able to have that as a job if that's something that they want to do. And I feel like I'm repeating myself a little bit from the last one, but one of those things in intentional peer support that we talk about is moving towards. And I think that's so important, especially for me in my recovery journey. Like there was all of these things that I was running away from or moving away from, and all of these things that were like damning me to the sidelines, and really trying to think of like, who do I want to be, or what do I want my life to look like, and really focusing on that and being able to go toward that instead of running away from all of these things that were dragging me down. So I think that that's really important in life at all, just to kind of focus on what are our strengths, where can we go with these strengths, and just how can we move towards something.
Good afternoon. My name is Brian Godinez, and I work with Promotores de Esperanza, and I also am a forensic peer navigator for the City and County Courts of Denver. For Promotores de Esperanza, I do outreach and community-based events. Our teams conduct outreach, and we do community-based events everywhere from Pueblo Pride to Denver's Cinco de Mayo to spread overdose prevention, awareness, and naloxone education and distribution across Colorado. This is why I go last, because I get nervous and start rambling over and stepping over my own words. But prevention, awareness, and naloxone education and distribution across Colorado with a focus on Spanish-speaking, indigenous, and other underrepresented communities. Trained in AccuDetox, our Promotores de Esperanza team is also trained in AccuDetox, a specific acupuncture protocol that is used after trauma to reduce mental health symptoms, including cravings, PTSD, anxiety, stress, and is practice that has been peer-led in the community driven for decades, specifically in the BIPOC communities. AccuDetox complements other clinical treatments like MAT services and therapy. And then for the Denver County Courts, another hat that I wear, is doing work in combating overdose crisis is through Denver County Courts. And the Denver County Court program was the first peer support program within the Denver County State Court. We started in 2020, and we currently have 5 peer specialist professionals and our peer support supervisor. So our peer support team is in the courtroom 5 days a week to provide in-person peer support for individuals going through Denver Municipal County Courts with lower level charges. We empower the individual by first giving them that choice to want to work with our program. We serve 1,500 individuals. Our goal was 400 people from 2023 to 2024, and we really hit our mark then. And we know, thank you. And we know that our program is working because 62% of the individuals we have served have not reoffended in the Denver City, County, or State Court. Thank you.
Wow, that's incredible. I'm truly honored to be sitting on this panel with all of you, and I think that what you've just mentioned is a testament to the power of peer support and the diverse roles that we all have within the peer support workforce. So thank you for sharing that. And thank you for the work that you're doing to save lives in the overdose crisis. So our next question is around, what are some of the challenges that you all are experiencing, and who are some of the champions that have been supportive to you all to make it possible for you to spearhead this work? What a friend of mine from the Yarrow Collective, Lucrecia, calls heart-led work, which I think is a great description of peer support. So whoever wants to take it away and go first, feel free. Okay.
Awesome. I think there's a lot of challenges to think about or to talk about. I think one of the biggest challenges, though, is the co-optation of peer support in more medicalized models. Peer support is a social justice movement, and it has deep roots in the consumer survivor ex-patient movements. And I think that's really important to highlight while we are simultaneously seeing this surge of folks realizing that lived experience has value and is really, really important to folks. It is also simultaneously being co-opted. And I think it's important that we are able to speak from our hearts. Lucrecia is an amazing champion for that. She moves with intention and with her heart. And I think that as folks with lived and living experience, we are the experts on ourselves. And I think folks that are struggling are the experts on themselves, and really centering that. And we, up here in Larimer County, have had some amazing advocates like Lieutenant Schaefer, and just some of our other community partners, Alliance for Suicide Prevention. Gosh, I can't think of them all, and that feels terrible. But we've had so many folks listen to what we are saying and what we need and what the community needs, and are able to uplift those voices. And it's not a foot in the door. I just want to say that. It's not a foot in the door. Peer support is an amazing movement and has deep roots. And I think us acknowledging that and being able to uplift that is super important.
Thank you. Yeah, I think I'll add to that. Some of the challenges that I've seen, and I just speak from my own experience at the Colorado Coalition for the Homeless, and at what I'm facing now at CU, is just that not enough people in the medical community are aware of the value of peer support or what peer support is. And, so I've encountered some professionals, where I had to educate, and where they're really curious. And so there's a lot of room for education in this area. Even though peer support has been around for so long and it's evidence-based practice, we still run into those challenges. So just like making sure that our peers are equipped with the education or empowered to educate the professionals around us, even though we don't match the initials and the titles and everything of the professionals that we're attempting to educate. A lot of times oftentimes we can be dismissed. And so we need our allies to kind of step up and help us out and letting our medical professionals and other professionals in the community know, like, this is a valued evidence-based practice, and it has value, and so those are some of the things, like, there are other challenges that we're running into, like getting into the jails, and because there are, like, misconceptions about who we are. A lot of us do have history and background that might make the powers that be a little bit nervous about allowing us in to do the work that we do, regardless of the work that we've done to move away from that history, right? And so we are professionals, and we would like, to be viewed as professionals. And I think what we need to do is continue doing the work well, and connecting and just asking for the support of our allies. And that's kind of what I'm here to do today. Just let you guys know that we don't do this by ourselves. We need help from the broader community. And so I think that is what I wanted to highlight. Oh, another thing I think that would be useful is to have like a peer supervisor certification, right? Because we need to be supervised by peers, should be supervised by peers, by other peers with lived experience, right? And so a lot of times we have people in positions of leaderships and program managers and supervisors that are not really fully aware of what we're doing here either. But if we have like the support of you guys to help like advocate for peers to be supervised by peers, for the state to come up with a certification for peers, curriculum, things of that nature, then we can better manage and progress forward what peers are doing and overcome some of those challenges.
Okay, I'll start with the challenge first. Not enough culturally relevant Spanish-speaking treatment, recovery, harm reduction resources, or we need more culturally relevant treatment, recovery, and harm reduction resources, Spanish-speaking resources, and community-based providers who we can do a warm handoff to. A lot of my work is centered around increasing accessibility for Spanish-speaking individuals who need recovery, harm reduction resources. We need to do better with this. We need more funding specifically for building capacity around recovery, harm reduction organizations that offer culturally relevant services. My champion, okay, not to toot our own horn, but the Promotores de Esperanza is being a newer organization, is doing an incredible job with raising awareness around this, and is also offering services connections for individuals across the state.
And to add on to that, thank you. So challenges for me being the leader of a very new, boots on the ground, very uneducated of all of the things nonprofit. The challenges for me have been having to wear so many hats. I'm boots on the ground. I'm doing the accounting. I'm doing the grant writing. I'm doing Yaki Detox. Like, so it makes it very, very hard, and it makes huge barriers for me to be able to focus on building. And well, I have to worry about where the next grant stream is going to come from. And the application process alone feels like foreign language. There are so many steps. There are so many barriers. There's so many times that I just threw up my hands and said, I'm not even going to apply for this. It's too much. So definitely the need for support around building recovery organizations. Definitely support around, technical grant writing assistance, and we are very, very thankful to have some champions in the community, like the Colorado Consortium, who they do help assist with some of the grant writing. The funding has been depleted, but we're hoping that it comes back really soon to alleviate some of those stressors. Um, Other champions, I'd like to kind of shout out to DDPHE, CDPHE, to Women's Health Foundation, or Women's Foundation of Colorado, to the Colorado Health Foundation, because they do have those low barrier application processes. They do have reporting processes that are so much easier. They do have funding that they offer for us to get self care. Those are much needed, and it makes it very instrumental for my team and I to keep doing the work that we do and keep energized and not burning out. We really we do a lot of networking in our community, and we see that other people are not taking care of themselves, and so we try to take care of ourselves more. And with the funding of these these foundations that do provide that support, we are able to send our person to Las Vegas, because I'm going to Las Vegas next week. Thanks to the Colorado Health Foundation. So yes, I think a lot of infrastructure support for new organizations. I think simpler processes, more funding streams available, philanthropy streams, those types of things.
Oh, hey, okay, yeah, I want to piggyback on a little bit of that. So when we're talking about like the funding is also one of the challenges that I wanted to highlight. A lot of times our peers are underpaid, and yeah, and so that makes it difficult, right, for our peers to do the work if they're like, in a lot of cases still struggling, just one step ahead of you know, one step away from being back in the same situation as the people that we're serving, right? And so one of the things that we were looking at is to increase, like to create like a job ladder for our peers, right? So we were looking at like creating situations, advancement to professional growth in our profession. So we're looking at like tier system, like peer 1, peer 2, and peer 3 system. So like a lot of times our peers are they come in at entry level pay, and maybe because that's fine when they don't have the experience, but when a peer has the experience, right, of doing this work for a while, and they have demonstrated that experience and they have the training, they should get paid as other professionals and other providers in the industry, right? And so, our work is not any less valued than others. Is my time up? Is somebody giving me the time? So, yeah, I think I wanted to just touch on that a little bit. Also, I wanted to highlight as the champions, you guys are the champions, and that's why I'm speaking directly to you all. You guys are our champions, each and every one of you guys. And so I don't know, like, if you want to take up our cause, if you believe in what we're doing or not, and I hope you are somewhat convinced by the time you leave here, right? But I think we already have a lot of allies in this building, in this conference, that believe in what we're doing. But I also wanted to highlight some of the work that my boss, Megan Robbins, is doing. Our manager, she has figured out a way to advocate for us to get that pay, and we would like, I just want to I know it's possible, right? Like, we can do this. Like, we're getting, fair pay where we're at in compensation. And when I talk to some of my peers around the state, I feel like a lot of times it doesn't match, it doesn't add up. And I would like to see that improve. And I would just want to say, like, the work that she's doing, like, she's creating a pilot to go into Arapahoe County, to get us into Arapahoe County. She's working on it. It's in the works. And so, like, she's really passionate, and we need that kind of passion from our leaders. And that's all I got.
Thank you all. I'm just going to jump in real fast and mention one of the challenges I think that currently exists is the fact that our living and lived experience is still stigmatized, and so is harm reduction. And as you can see, we have a diverse panel up here of peer support leaders working in various sectors across the state. And like Bruce mentioned, you know, these like the opportunities that like for us are different from opportunities for new peers coming in the door, and like we need to have both. And so I think that, you know, we just need to, you know, I feel like a lot of times like our living and lived experience is, it's still stigmatized, and like especially when thinking about like getting into jails, like I firmly believe that, you know, the longer somebody's been incarcerated, or the more experience they have in the criminal legal system, if the more they are valued and the more of an asset they are to be working inside carceral systems. And so we need to, whatever we need to do, and I think that's where we need the help of you all, is I think, you know, Brooke and the panel this morning had a really amazing conversation about how we can do this better when we collaborate and really just like lean into each other, because you know, I've worked inside the jails, and I know what it's like to be inside the jail, and to have, you know, people that are like, you know, I really just don't want to get released to the streets, and like we know what that feels like. We're the most qualified to be working in there. Like every single time I've overdosed, it's been upon leaving jail, and yet so many of my colleagues that are way more qualified to be working in the jail, that have much more experience, just aren't able to get in. And so yeah, I just want to call out, you know, champion Lieutenant Stacy Schaefer, and like leading that in the Larimer County Jail, because yeah, and the Yarrow Collective and all the peer support folks, Ashley and her team, because like if it wasn't for y'all's leadership, we wouldn't have a model to model. And so I'm really excited to continue this work and learn from those who've been spearheading it. And then with that, I'll pass it to Rika. We're co-moderating, so.
We had to make it just a little more difficult, you know? I want to thank Betsy for jumping off that very important conversation. This is just all around badassery here, and I can't really go off of the script anymore, because it's really, you know, the work that we do, and who we are as people, and it's our passion, and it's what we love to do. But I'm getting a 3-minute warning. So our next question is this one. Okay. So what is your vision for transforming the Colorado peer support workforce over the next 5 years into the best it can be, and what are the steps that we need to take to get us there? And we'll start with Ashley.
It's a heck of a question. So I think for me, I think envisioning what peer support could look like in the next 5 years, kind of like I talked about in the beginning, is really like recognizing peer support at its radical roots, honoring its lineages, and really centering people with lived experience as the experts and uplifting that. I think Bruce touched on a little bit like pay equity and things like that. You know, that's that myth of unskilled labor, right? Like that there's no unskilled labor. And so for us to be sharing our lived experience, we're really checking in constantly with ourselves and where we're at. So it's not only like supporting other folks, it's also taking care of ourselves and seeing where we need to grow. And I think like we touched on, having supervised peers is extremely important, because you can't know what it's like to do this work if you haven't done the work. And I think that's like super important. And I think there are some agencies, like some larger agencies, that are really seeing the value of peers. I actually think that that's a federal guideline, honestly, is that peers should be supervised by peers. Yeah, it is a federal guideline. So I think that we just should follow that. And I think that, really just uplifting those voices and the new voices and making room for all of that and understanding that peer support isn't a foot in the door. We're not mini clinicians. We're not here to meet people where they're at, to move them to where we want them to be. We're here to meet people where they at and radically love them.
Oh, that's me, huh? Thank you, Ashley. We'll go to Betsy.
Awesome. Yeah. I honestly feel that we just need more peer support integrated into more systems. And some of the work that I feel really honored to be able to do is like working, using my living and lived experience for research and policy advocacy. And so this is like a testament to working with, other champions in other sectors. And like, I just want to shout out, Dr. Kate Lemasters, and being able to, I feel like, this is just a testament of like how well this can work, because, one of the subcommittees I lead on behalf of the consortium is advancing the peer support workforce in carceral facilities. And, we did a statewide survey to find out, where peers were at and which jails, and, which jails we're trying to get into. And if it wasn't for the partnership and working with Dr. Kate Lemasters, it wouldn't have been able to have like a research partner to do a more formalized study around the peer support policies and around the harm reduction interventions and the other, medication-assisted treatment policies in the jail. And so I really think that that's a testament to, us working together better. And I think that's what I'd like to do more so over the next 5 years, as well as just more policy advocacy. I just started a new organization called the Underdog Alliance, and that's really what it's about, is elevating living and lived experience. And like we all mentioned, our stories are really powerful. And I think more folks need to hear it. And I also think that, we need more collaboration with law enforcement. And just want to plug that we're also going to be doing a panel tomorrow about the power of peer support when we integrate it into jail-based systems of care. And so that's all.
Thank you, Betsy. Oh, I was taking it. Bruce, you're on. Are we at time? Okay. We'll just do questions? Okay. So we want to go ahead and open it up. If anybody has any questions for any of our panelists, please feel free to let me know. I'll bring you a microphone. Anybody? Any takers? Yes. I love when people make me run around the room. I need my steps today.
I like the idea of pay equity a lot, but one of the questions that always comes into my mind, I'm just going to be explicit with it. How much should an entry-level peer be making at an absolute minimum for this work to be sustainable?
I think it's extremely important to pay peers a living wage. So what does that look like in your communities? And that's sustainable.
Anybody else want to answer that?
Over here, way over here.
Another question. Thank you. Getting my steps. Oh, she's on it.
Yeah.
Thanks. I actually had a related question. Obviously, being underpaid is a huge issue in retention and recruitment, but what other challenges or supports have you seen in your efforts to recruit and retain peer specialists?
I would say, I think sometimes that like the lack of organizational wide education and training or agency wide can be a barrier, because a lot of times, like we've mentioned, like this is really hard work. And when you have to constantly advocate for what your role is and what it is not on top of doing the work, and you don't have the support from your leadership, that's what causes burnout. And so I think that in order to implement a peer support program, like we're going to be doing this on behalf of Arapahoe County Public Health. We're going to be writing a grant to have a peer support program in the Arapahoe County Jail. And I think it just takes a lot of, first we got to do that organizational wide education. And that's where I think that our statewide leaders need to step up. I wish that we had more of like a statewide infrastructure for what it is, to hire a peer support and how to retain a peer support, onboard, train, and retain, because we can't be doing this work every single time we want to, implement a peer support program. It's just a lot of work. So I think that it would be great to have more of that from our statewide leaders.
Thank you, Betsy. Any other questions? Georgia, do I see your hand up? Ms. Stephanie? Georgia's behind you, and I'll get Stephanie. Go ahead. Georgia, go first. Georgia, go ahead. You first.
Is that working? Yeah. What do you all actually support people who are going while they're in training to pay them a living wage as well? Do you do that, or do you wait until they get their certificate? Are you able to pay people while they're in training?
Yes, we are. We do a lot of our trainings in-house. I also worked for a community mental health center here in northern Colorado, where we would hire folks and then offer them the training while they were employed.
Yeah, there are a few different programs like that. I know, like Colorado Village Collaborative, they'll put you through the Colorado Mental Wellness Network training, which is an 80-hour peer support specialist training, and you can still work while you're getting trained. And I think we need more programs like that so that we're not asking peers to get their hours and work for free while trying to get certified. Like, that's just not sustainable. So, we need more organizations like Yarrow Collective and Colorado Village Collaborative, and I'm sure there's some other ones. I just can't think of them.
Yes, I think that's definitely, there's a lot of success in doing it that way. We've done it that way at the Colorado Coalition for the Homeless, and so entry-level peers would come in untrained, and then we would cover the cost of their training and pay them entry-level wage. And then upon their completion of their training and certification, then they would level up and increase in their pay. And so that way there's like a pipeline and getting people in and meeting those people where they're at and getting them up to par and up to standard in order to provide adequate support.
My question is pertaining to getting the peer recovery coaches into all of the jails. This morning we heard some amazing opportunities in some of the counties, and I also sat next to the Boulder County Sheriff who conveyed that they are utilizing them extensively. So my question is there some type of movement or policy in order to have this be applicable statewide and not have to have those barriers in some counties where you can get in and some counties where you cannot?
Betsy, we'll let you take that one.
That's a great question. So I think we'll be discussing this more with the panel tomorrow, with the power of peer support that Jose Escobar will be moderating. But, we started this work back in November of last year after the Colorado Consortium annual meeting, and it was named that it's a barrier and that a lot of peer supporters can't be getting into the jails. And so we thought that it would be, we started down the pathway of seeing if we could implement a statewide policy, but we learned that that's more than likely not the best way to go. I feel like it would, it's just more of like a heavy lift. I think right now where we're at is just showing the efficacy of, like the programs like Lieutenant Stacy Schaefer's, and just trying to model it one jail at a time, because I wish we could have a statewide policy that said that you have to have peers inside your jail, but unfortunately I'm not the decision maker on that. And but yeah, if somebody wants to bring a bill, I'd be more than happy to advocate for that. So thank you.
Thank you. Do we have time for one more question? Oh, go right ahead.
we've been speaking about adults and peer support for adults. Where are we at with our youth in peer support programming with our youth and our corrective institutions that our minors are in right now? They're incarcerated as well. So I'm just wondering where we're at on working with our youth.
Yeah, so we are currently working with, I think it's called Platt here in northern Colorado, where youth are incarcerated, trying to work on getting in there. It is extremely difficult to get in any youth facilities, but we do quite a few youth support groups and have been working with youth probation and some of the school districts to try to get in, namely Poudre Valley School District, to get in and start really working with the youth. I think the challenge and the beauty in that is we really want to prioritize youth as the peer supporters, right? Because I'm 41 years old, and so I'm a little bit out of the realm. So we really try to prioritize youth doing that work also. So that's something at Yarrow that we've really been focusing on, is uplifting youth voices and doing panels and some focus groups with youth, trying to figure out what's best supportive to them.
At Promotores de Esperanza, we're also working with youth. We receive referrals from Signal Behavioral Health when youth are being involuntarily committed. And so then we meet them after the detox process when they're at the detox center, and then we start to establish relationships with them. And then once they transfer into a treatment, residential treatment program, we walk alongside of them and help them navigate those processes and help them, learn the layout of the land and what is expected of them, to really just try to support them through their treatment. Last question? Everybody okay with that?
I'll keep my question quick. So you talked about just the importance of recognizing burnout as far as sharing your lived experience and your truth. I'm curious if you found or could provide any insight on what it looks like when someone is actually interested in becoming a peer. Sort of what step or stage are they at in recovery? What are you looking at so that there isn't more harm or sort of triggering as far as venturing into this?
I'll take that one real quick too before
Go
you
for
first.
it.
Sorry. At Promotores de Esperanza, we are making sure that people are in recovery for at least a year. Once we get them into their certification classes, we walk alongside them through their training, and then we have them come alongside of us to kind of do like an apprenticeship program where they come and learn, and they actually do hands-on work before we send them out into the field.
So that kind of is the standard. That's like the nationwide standard is a minimum of 1 year of personal recovery, and we like to see like in some cases you'll see where we're asking for stability for 1 year in their personal recovery, because you can be in your early recovery and still be really unstable, and so that that's like the minimum of what the standard is nationwide. And I think in some cases 2 years even, right? And so, but I think connecting someone with a mentor or someone that's already a peer, and a peer can also walk them through the process and connect them, and what that looks like and what it entails to, everything that entails to become a peer, because there's a lot of different moving parts, like, your education level and whether you're on or off paper, things like that. That have to be considered. So we could talk about like each individual might have different circumstances, and if they're connected with like another peer to mentor them, that would be helpful.
Thank you.
Can I say something really quick? I just want to say that, like, I know we're all trying to like find the magic numbers and all like the right things to do, right? But my recovery at 1 year could look really different than somebody else's, and I don't think that like we can like arguably say like if you hit these metrics that you're good. I mean, at some of the places I've worked, we've hired people on paper. You can be on probation for 5, 10 years, or parole, things like that. So that doesn't necessarily disqualify folks. So I think really it's person by person basis. And like at least with Yarrow Collective, we do not treat anybody as fragile. So if somebody is going to have something that's triggering for them, We trust that they will come to us and talk to us about that, because we can never guess what anybody's going to be triggered by, right? So I think it's really important to treat people as the experts of themselves.
Absolutely. Thank you so much. Thank you, everybody, for being here with us today. We really appreciate having all of you here. Thank you for the questions. And thank you for all of the work that you all do. Please continue fighting the good fight. And we all have cards up here if you would like our information.